Hello, I'm Stephanie.
And I'm Lauren.
And this is I've Got Guts, a podcast about living and thriving with chronic illness.
And all the things that take guts to say out loud.
We're here to talk about the hard stuff, the stuff that's messy, complicated, and often left unsaid.
From chronic illness to everyday life, we're creating space for honest conversations, real connection, and yeah, a lot of laughs along the way.
And just so we're clear, we are not medical professionals. We're just two best friends sharing what we've learned and what we're still figuring out.
So you don't have to do it alone.
Hello, everyone, and happy December, my favorite month. Laryngitis Lauren, how are you feeling about being December?
Well, I am a little bit raspy. Little esophagus damage over the weekend, but you know.
I think this leads perfectly into thorns and roses, and you have quite a thorn. So.
I have quite a thorn. So I don't know what I did. I ate Thanksgiving dinner too fast. Okay, that's one. I don't know what it was. First of all, we go to Sean's aunt's house, Aunt Mary, and she is hosting how many of us? I don't know, 20 something.
That was a hefty crowd.
It's a big crowd. It's a great crowd. It's a fun crowd. Thanks. I literally went to one O'Reilly Thanksgiving. And then after that, I called my mom and I'm like, sorry, Mom, I'll never do Thanksgiving with you again.
Yeah, it was so fun.
It's just such a fun holiday with them. So Mary's hosting it now and she did a beautiful job. Everything was like so great. But I just sat at that table and I piled on my plate and then I just ate it all, the fastest I think I have ever eaten food. I was done before Sean was done. Sean goes, "What did you just do?"
Oh, no.
And then I sat there and it hurt.
Yeah, the pressure.
It just hurt and it was stuck. So then obviously I did the most logical thing and I decided to just continue on the wine path and just chug wine all night. Yeah. But it was delicious wine. Erin gets really fancy wine from her job and it was so yummy. So anyway, that kind of like helped to move things down. But prior to that, Sean made some bacon on the grill and I swear that cut me up. I don't know. So my esophagus is just.
We don't know the assailant.
No, and it's like, I feel like with my achalasia, not everybody gets raspy, but for me, that's like when I'm in a rough spot, I get real raspy. So, which leads into, I had my appointment with Dr. Jones.
You did?
My thoracic surgeon. So it was a fast and furious appointment because she was definitely, I waited like an hour and a half. She was behind and she felt so bad. But you know, I went the Wednesday before Thanksgiving at 3:00. So, I met with whoever the person is first. First. They come in, they run through everything with me. And you know what was really funny? He's like asking me how I'm feeling. And I'm like, I'm actually feeling pretty good after my balloon dilation. And he was like, okay, great. He's getting like all my symptoms. And then he's like, do you have any questions for me? I'm like, well, yeah. How'd that manometry look? And he's like, well, I'm going to just let Dr. Jones cover it.
So
then I'm like, okay. And he's like, no other questions. I'm like, that's the only one. That's why I'm here. And he left. And then I like sat in in the room or whatever. And I'm like, okay, so he didn't want to break it down. So it probably isn't the best news, but it's not terrible news. So she comes in and said my manometry. First of all, let's talk about the positives. My barium swallow looked pretty good. Yep. She was very impressed with how the liquid was moving through. She thought I had a lot more just flowing than she anticipated. So that was a great win. It was also after my balloon dilation.
Right.
And then she said the manometry, last time I had it done, it was 50% of the time my esophagus was working. So 5 swallows I had.
6 years ago.
6 years ago, I had 5 swallows that were where it was doing peristalsis, my esophagus,
right,
and 5 where it did nothing.
Right.
So 50%. So I went down to 10%.
Yeah.
So it's a low number, but she was so cute. She goes, so there was a little bit of movement. I'm like, okay. And she's like 10%. I'm like, okay, 10% I think is good. It's better than nothing, right?
Yeah.
So it's better than nothing. So she was like, all right, Lauren. I'm like, all right, Dr. Joe. And so what does this mean for my future? She's like, well, you're feeling good. I'm like, yes, food is going down. And here I am all torn up and raspy right now. But She said, we just are going to go based on how I feel. So as long as food is moving and I'm keeping weight and hopefully this raspiness doesn't last too much longer, we'll just follow how I'm feeling.
Yeah.
We're going to stick with balloon dilations, no more with my gastroenterologist. We're only going to her. And the reason I think the balloon dilation worked a bit better is because she she's got bigger balloons. She dilates me bigger, larger.
I like big balloons, and I cannot lie.
She stretches me real far, and so she could do me better than Dr. Goldstein. So we're gonna just go with her from now on.
Yeah, that makes sense.
It does. So she just is scheduling me every 6 months, but she's like, Lauren, if you feel in a month, you call me, I'll get you right in, I'll stretch you. And she's like, and then if the balloon dilation doesn't work, that's when we have to have other conversations. But right now we're just gonna lead with how I'm feeling. So
I'm gonna be honest with you, I didn't tell you this, but I took the news harder than you did. I had a little bit of a panic attack after we got off the phone. Just because I've watched you go through this, and to hear 10% was just, I think it was just so shocking to me. Like I wasn't expecting it, I guess. And I know somewhere down the line, it's going to mean big things for you. And as your best friend, it was hard for me. I'm not going to lie.
I know. And you're like, you're okay. I'm like, yeah, I think I'm okay. I mean, 10% is better than nothing. You're like, okay, if you're okay.
Yep. But then I hung up with you and I cried. So I cried for you.
I love it. Thank you. I think for me, I knew something changed. I knew something changed. So I went in there knowing something was different, but we'll just do it one day at a time and one balloon dilation at a time.
You are the strongest person I know. So if anyone can handle 10% esophageal function, it is you.
It is me. And I'm going to do it with grace and ease with a side of laryngitis.
Exactly.
All right. I'm going to rest my voice now. Your turn, Room. What is your thorn?
So it was really hard for me to think of one, which is great. It's been a wonderful 5 days. So the only thorn is, and it's actually tied in with a little bit of a rose. We went out to dinner last night with our friends.
Oh, yes. How was it?
Wonderful. We met Keegan's brother for the first time, which was so nice. We went to a restaurant around here called Trotta. Food's delicious. And I had the most amazing meal ever. It was salmon with like this creamy sauce and mushrooms and French fries.
Yum.
So I ate the whole thing. At 6:30, sometimes I can handle that. We went to bed late last night. Like it was about midnight when we got into bed.
I love when you guys have a late night. I'm so proud of you.
But my esophagus was not happy with me. So it started when I was brushing my teeth because I was like kind of bent over to brush my teeth, and I like threw up in my mouth a little. So I had Anthony do this thing where he like rubs his knuckles down my esophagus because then that sometimes helps to get things moving.
Yes.
It didn't work. So like we get in bed, Anthony out like a light within 5 seconds. Me, I'm sitting there every 5 minutes throwing up in my mouth. So I kept having to like shoot straight up in bed. I'm like, go down, go down, go down. I never actually fully threw up. I threw up in my mouth so many times. I kept having to go in the bathroom and rinse it out with mouthwash. And then it's just, that feeling. Yes. It was like just the pressure and the uncomfortableness. Like by the time I fell asleep, I feel like it was 2:00 in the morning.
Oh, that's the worst.
So I didn't throw up. This is a positive here. Yeah. But this is where when I tell people, like, I'm living this great life, I still have gastroparesis symptoms. Right. Like, case in point, last night I ate. It felt fine when I ate. It was just sitting and not moving fast enough out of my system. So that's 6:30 to midnight. That's almost 6 hours, and food was still sitting in my stomach.
Right.
So, every now and then it happens.
Yeah, you're doing the best you can. But from the outside looking in, like if we were at dinner with you, right? Everything you're eating, it's going down, you're happy, whatever. So you don't see this stuff behind the door.
Keegan's brother caught on though, because I had to ask the waitress so many questions. I was like, so the potatoes that come with this, do they have skins on them? She's like, yes. I was like, skip those, give me French fries. I was like, and the sauce, is the corn chunky or is it blended? She's like, let me go ask about that one. So she leaves and he's like, what are your dietary restrictions? I'm like, I have gastroparesis. It's a thing.
This is it. This is why I'm asking all the questions.
Yeah. Can't have skins, can't have whole corn. But they made it work. The waitress was wonderful. She substituted things for me and it was great.
That's awesome. Yay. Yeah. Well, good. And it was a nice dinner.
It was a wonderful dinner. Taryn sends her love, by the way.
Oh, hi, Taryn. I love you.
She's so nice.
I miss her. It's been a long time.
I know.
It's been a long time. All right. Roses.
You go first.
Okay.
Clear that voice.
Let me just get a sip of tea here.
Gotta keep the warm tea flowing.
Oh my goodness, I can't even. Okay, so I feel like my rose is Connor and I decorated our entire house for Christmas.
I saw the pictures.
And it just brings us so much joy. I feel like last Christmas was our first Christmas in our new home. And I had a little bit of a hard time, figuring out where things are going and decorating. And I was missing my old house a bit, my fireplace, and change is hard, right?
Change is
we
hard.
love our new home, and I was missing Dorrington, our old house. But that's my rose this week because it was so fun. We figured out a new place for our village.
It looks beautiful, by the way.
Thank you. I have my new farm table. So did you see my candles on my farm table?
They look so nice.
And I've never had a nice dining room table ever in my life.
And the garland on the staircase.
Thank you. Yes, we hung our stockings. We did everything but the tree. So currently on the hunt for a fat, juicy, tall Christmas tree.
Lauren is the queen of the fattest, plumpest trees you've ever seen in your life. To the point where you're like, how'd you even get that in the door?
Yes, the bigger the better. And we kind of did a little perusing this morning. And Sean's like, that's 11 feet tall. It's not going to fit. I'm like, no. And it just, we couldn't find the right. They're all so skinny and short out there. What's going on with these trees
I'm
these
just
days?
full of song references tonight. I just thought in my head, fat bottom trees, you make the rockin' world go round.
Well, please, somebody get me a fat Christmas bush because that's really what I want for this holiday season. So stay tuned.
Stay tuned.
Decorating is not complete, but the Bills game is on today, Sunday, so it was probably best we took a pause.
Yeah.
So they can immerse
boys
themselves.
Can't decorate while the Bills are
in the game, and we'll finish our decorating over the week.
Yeah.
What was your rose? Roses.
So I have a few. You were like, narrow them down. I'm like, I can't. I have so many to share. Okay, I'll make it quick though. My first one was Anthony came and volunteered in my classroom on Tuesday, and it was so cute. Just the kids were kind of didn't know what to do with him because he's so tall. They kept just walking up to him and looking at him like, who are you? But thank God he came and helped me. We were dishing out Thanksgiving plates faster than lightning, but it was nice to have his help. It was also nice for him to be immersed in what I do and meet my kids and see everything. And it was really nice for me to have him there. It meant a lot to me.
So fun. So fun. Sean used to always come into the classroom and cook pancakes for my class.
I know, I remember.
And it's almost I feel well, your kids are younger, but I always felt like they thought Sean was a celebrity or something.
Yeah.
Mr. O'Reilly's coming in.
Yeah, my kids just thought he was a new person in the classroom. Yeah. Except for one of my students who thought he was my dad because as soon as he walked in, he goes, your Daddy's here. That's really cute.
Yeah, that's really funny. I'm struggling to laugh, so I'm laughing in the inside.
I know. Obviously, Thanksgiving was wonderful for us. It was small. We spent it with my parents. I did enjoy the Thanksgiving Day parade this year. I don't know, definitely geared towards millennials.
Okay.
Right?
I just have to say,
Busta Rhymes?
I mean, it was kind of like a
Shaggy?
Late 1990,
Lil Jon,
early
I was
2000s.
dancing.
So good. So good.
And Debbie Gibson?
Amazing.
Oh my God. It was just definitely a parade made for me, for sure. I was feeling it. But
yes, it was a good one.
We also saw the second Wicked movie, and it was wonderful. And their relationship reminds me so much of me and you that at the end of the movie, I was crying like a baby. And Anthony's like, why are you crying? I'm like, it's me, Lauren.
I love it. See, I wish
you hate musicals.
I hate musicals. Fun fact about me. Me and musicals do not go well together.
I know you can't see past the singing, but if you could, the story of the friendship is just so powerful. It's definitely.
And I did try to watch the first one.
You hated it.
It was so hard for me. Every time I'm like, not another song.
Okay.
Why do they have to sing everything?
I know.
3 songs.
This one was a lot of songs. And my last one is a big one. So we talked to the fertility clinic.
Yes.
And we are proceeding with another retrieval.
Okay.
And it will fall about Christmas time. So Anthony and I both have to go under this time.
Don't worry, I'll be your designated driver.
Yes. So we're switching things up a little bit and doing a different procedure. So they will retrieve my eggs. And while they retrieve my eggs, they are going to do a procedure on Anthony called a tessie, which is they're removing testicular sperm. So there's no stress to it. So it's fresh and healthy.
Right.
And we're going to
see. It's not going through the canal.
It's not going through the canal. It's not stressed out. I don't know what it's called. But
you guys know what we mean.
We're hoping that this combination might give us stronger embryos.
Okay.
It's one of those things where I think if we didn't do it, we both would kind of always wonder, like, what if we had tried that? You know what I mean?
Would that, in hope, get better quality, right?
Right. That's
embryos.
The hope. So we're checking off all the boxes. And it falls when we already have 2 weeks off of work. So you know what? Why not?
Right. Exactly. It's perfect. I think it's great. And I feel like it feels like what's right for you guys.
I do. I feel like I have a solid plan. And my surgery to check for endometriosis has been scheduled for February. So I just feel like everything's falling into place kind of. And I keep getting these weird feelings and signs. I got the bit craziest sign from my grandpa the other day. I got a penny from the year Anthony and I got married. My grandma keeps sending me numbers. Anybody who doesn't know me, I fully believe in these things. So I keep seeing signs all around me. And I feel like it's bringing us to our baby.
Of course it is. Yes. The spiritual world is closer than we know, right? And if you tap into it and you are aligned with it, those pennies are going to shower down on you. Especially those specific ones. That was a wild one.
I know, that was a wild one. All right. So before we get into our interview today, let's talk a little bit about Cozy Earth.
Yes. Okay. I have to talk about what I just ordered from Cozy Earth. So I'm digging around and I wanted to get something like clothing item and a clothing item. And I found so cute. It's like a long sleeve white, almost like a waffle. It looks like material. From Cozy Earth. So I'm losing my voice.
It's going. You got the shirt. So a review coming.
A review is coming. It's shipped. So actually it should be here before we record again. So
this is exciting.
Stay tuned. I cannot wait. And of course I used our code IGG and I got, oh my gosh, so much, 41% is a lot
Which is more than their Black Friday sale.
I know.
I just want to throw that out there to everybody.
Because I'm getting all these alerts. I'm like, not as good as ours.
So if you want 41% off of anything at cozyearth.com, use our code IGG at checkout. Sheets, clothing, blankets, towels.
I have to tell you one other thing I'm going to order. It's in my cart.
What is it?
I want a new robe.
Oh, their robes look glorious.
Okay, they do, but I'm really having a hard time deciding if I want like long or short. So I'm waiting, but that's going to be my next is a cozy robe. I got really excited.
We're looking at the blankets. The throw blankets, but the thing is they come in like 4 different designs and each design has a different set of colors and you know me, it's stressing me out. So I have to like pick the perfect texture and the perfect color, but I'll get there.
You'll get there. You always do.
I always do.
Always do. It's such a great sale.
So IGG at checkout for 41% off.
Love it.
All right.
So a few episodes ago, we had my good friend Kaylee on who shared how gentle chiropractic care completely changed her day to day. Better digestion, calmer stress response, fewer aches, and even support for her kids' health.
And after that episode, so many of you messaged us saying, wait, I need to know more about how this works. So today we're bringing you the science, strategy, and heart behind Kaylee's experience.
Joining us is the incredible Dr. Maggie Benham, board-certified chiropractor and co-owner of The Chosen Spot Chiropractic and Wellness right here in Canandaigua, New York. But as I'm saying this, Dr. Maggie, you got married and Benham is not your last name anymore, or is it?
Well, it is. I've just been a little lazy about changing it. So
okay. It's like hitting me as I'm reading that. I'm like, wait a second. She does have this beautiful family.
Yes.
Okay.
It will be Benham Witcher or Witcher, but yeah.
Okay. It's a pain in the butt, change your name. So I don't blame you.
I know. So I've been a little slow with that, but.
Dr. Maggie holds a doctorate from New York Chiropractic College with an advanced certificate in sports science and human performance, a bachelor's in biology from SUNY Geneseo, and certification in applied Wow, I can't say this word.
Kinesiology.
Oh, kinesiology. Let's say it together. Kinesiology. Are we not teachers or what? So Maggie's approach is both compassionate and precise. She focuses on restoring nervous system function with gentle, specific adjustments like upper cervical work around the brainstem activator, assisted adjustments, drop techniques, pelvic blocking, and so much more.
And beyond the table, she helps patients support their nervous systems through nutrition, breathwork, and lifestyle practices that align with their health goals.
We're so excited to dig into the why and when of chiropractic care, what that first visit really looks like, and how this work fits alongside conventional medicine.
Dr. Maggie, welcome to I've Got Guts. We are so happy to have you here.
Oh, thank you for having me. I'm honored.
Yeah, this is exciting. We've been dying for this.
I feel like you're kind of a celebrity amongst our listeners right now.
You are.
You obviously know Kaylee. You've been working on her for many years, and she's just, her story was so powerful. And I think it really resonated with so many listeners.
So many people after that episode were like, I was just like you guys. I thought that going to a chiropractor would mean they were going to like aggressively crack me. And after listening to that episode, I feel differently now.
Yeah.
Oh, I'm so glad for that. Yeah. We're no strangers to some of the stigmas and images that people conjure up in their minds. And it really is just nothing like that. So it's one of my favorite things to do is to talk about how it's actually quite different.
Yeah. Yeah. All right, let's jump in. So before we get into all the specifics, we'd love to start with your story. So like what originally drew you to chiropractic care, and what was it about this type of healing that really spoke to you?
Yeah, I had a really positive personal experience from a young age. I think about 10 or 12 is when I started going to the chiropractor, and it was a family chiropractor. So it became very normal for me to go. But he was an applied kinesiologist like I am, and he really became a mentor of mine for many years after that. But throughout childhood, high school, college athletics, I regularly saw my chiropractor. And I was aware even then that this, not everybody was doing this. But I would drive an hour to go see my chiropractor. Wow. in college when I was playing lacrosse. It made that much of a difference in my physical, my athletic performance. And, he helped me in a very physical way. I had repetitive ankle sprains. That's why I initially went to the chiropractor. It was repeat ankle sprains. But then later on, I had a fracture in my lower back. And he was the only one to find it at the time. And that was the only thing that helped. So more than just the physical care, I always felt amazing after my adjustments. I always felt like a new person. So it made a lot of sense to me in that way. But I also learned a lot about other aspects of my health, whether that was digestion or how stress showed up in my body, or diet, and sometimes just a need for rest. He really helped me to understand what my personal needs were, and he knew what I needed based on his assessment of my body and getting to know me in that way. So I would leave often with maybe some education. I would leave with maybe a nutrient or a supplement if that was indicated, an exercise of some kind, and always some level of new knowledge about how my body worked. And the messaging, as I look back, was always that I was actually really powerful. Even if I wasn't feeling that way, I was feeling sore or weak or something was going on in my body that was really unfavorable. The message was always, actually, I'm really powerful, but I needed something I wasn't getting, or I needed balance. And so on principle, the fact that I could find my own power and heal myself was really sort of empowering and mobilizing when I was having, these issues at a younger age. And the principles he taught me were all sort of natural laws, they were about nature working through us. And so those are the things that I think intuitively drew me to chiropractic, was that it was natural, it was empowering. And on a personal level, I think I needed to do work in my life that would help others. It needed to be service-based. And I can't tell you how deeply that became true.
Yeah.
Oh my gosh, I have all the feels, listening to your story.
I wonder if we had done something like this when we were younger, if it would have changed the trajectory for the path that our bodies have gone down.
Yeah,
for sure.
I get that.
Yeah,
I get that. And it is why we also in our office, it's not just adults that we work on. We work on babies and toddlers and growing children, because I'm sure we'll talk about it more soon, but what you're achieving through chiropractic impacts growth and development as well. It's not just about fixing things, you know?
Right. So, right. Yeah. And, well, that leads into our first question. When Kaylee joined us, she really helped overall just debunk the idea we both had about chiropractic care, and we said it in our minds, it was about aggressive cracking is what we thought. But can you explain what's actually happening during chiropractic adjustment for adults and kids? Because Kaylee brings her whole fam to you.
Yeah. Oh my gosh.
So what is going on when somebody comes in for an adjustment?
Yeah, I've always loved to walk people through, like, out of the fear and misconception that they sometimes arrive with. It's and into sort of what's possible through this work. And the adjustments themselves can vary, like, even across chiropractic offices. And I'd be happy to kind of describe the way we deliver those adjustments and how an appointment goes. But I think it might be helpful to actually talk briefly about why we adjust, like what we're doing, what we're trying to achieve, because once you understand that it isn't actually about being cracked or adjusted, it's about what that achieves. And because the spine houses the nervous system and surrounds anatomy like the brain stem up in your neck, adjusting the spine actually impacts the brain. Chiropractic changes the brain. And this is empirically shown now. It lights up actually a part of the brain, especially the prefrontal cortex, which is responsible for things like executive function, emotional regulation, movement and muscle function, spatial awareness, okay? So a good chiropractor, a neurological chiropractor, is really looking at not just your alignment, but how your brain and your body are communicating. And when we adjust you, ideally, your brain and your body begin communicating better. There's more coherence and connection, okay? And this is really enormous because, as you know, even as teachers, the nervous system controls everything. Literally trillions of cells are informed. Your biology is informed by the nervous system. And all these other systems are also integrated with it: the immune system, the endocrine system, the digestive system. So even though the misconception is, or the image is, that it's about cracking the spine and releasing some kind of pressure, it's actually this movement that is delivered in a very intentional way and specific way by a good chiropractor actually is about the nervous system and impacting how your brain and your body are talking to one another. So teaching new patients this is sort of a really big shift in messaging and the lens that they're looking at this with. And once they see how gentle that it's delivered, it's sort of a game changer. Then it starts to make sense that you would not only do this for yourself, but that you do it with regularity, because making sure your brain is talking to your body is sort of a big deal. And you'd want that to be the case. You'd want that to be the environment all of the time. So again, there's some variation across chiropractors, across chiropractic offices. But in our office, our adjustments are really exceptionally gentle. To give you some context, I like talking in stories because that's more helpful.
We love a story.
But in our office, our youngest patients are 0 days old. Okay. And my oldest patient was 103 before she passed. So the way that our adjustments are delivered, and in an individual way to meet the needs and the appropriate age range of that patient. There's so much intention and care about that. And again, very, very gentle. So because these techniques, the techniques we use in our office as kinesiologists, will determine where the disconnections are. Okay, so where is it that your brain's having a hard time talking to your body? Because we have a way of determining where that is, we don't have to be very aggressive about anything. And So some adjustments are performed with our hands and gentle breathing, okay? And some adjustments might be delivered with pelvic blocking. So these wedges that we put underneath your pelvis as you lay on a table, and that they kind of categorically align your pelvis. So you might settle into an alignment and move your body in a way that's really gentle. We also use a spring-loaded tool called an activator. Kaylee did a good job of explaining that. It was really fun to actually hear a patient describe these things. She did an amazing job.
She really did.
Yes.
But I was like, oh, that is what it would look like. Yeah. But this tool is a spring-loaded tool, and it's a very gentle way of delivering sort of an impulse into a joint space to, again, get the brain talking to that part of the body. And all of those techniques serve to restore the brain's connection to the body and stimulate the brain in a very specific way. And you both described some of the other techniques that we use, including like craniosacral therapy. I'm not sure if you're familiar, or somatic releasing techniques, acupressure points. So with this, in the spirit of sort of releasing tension that's been built up in your fascia or your energetic systems. And often that's been there for a very long time, So our adjustments are intentional, they're gentle, and it's serving to kind of balance your mechanics and your neurology. But we can usually find a way that's really comfortable. So most everyone enjoys the experience of being adjusted. It's not something they have any apprehension about. So.
Yeah, from Kaylee's description, like she just walks out of, it's almost like you're performing some type of magic. The way, from Kaylee's perspective, I'm like, ooh, yes. I feel like I love it, but it makes sense. And I think the body is just such a unique system. And I love how it's almost like you're just stepping into your own power of healing yourself versus, reaching for all of this outside stuff to make ourselves feel better. And it has me thinking, I have like chronic pain in my my shoulder and my neck, I think I was telling you, and I get migraines and tension headaches. And I mean, you can visibly see my muscles jacked up on the side and then normal on the side. So I am coming, and I am so excited to see, let's release this tension because it is tight.
Well, we'd be honored to have you. We'd be happy to help. And it's not unusual for most. I don't know if anybody's ever come into my office without some kind of asymmetry mechanically, we've all lived lives that create injury or trauma or imbalance. And so you don't have to also wait until there's pain or dysfunction. That's the other exciting thing about this is most everyone is walking around with some imbalance and until your body can't really compensate for it anymore,
Right.
So,
yeah.
So one of the biggest transformations that Kaylee talked about was with her digestion. And after years of GI issues and no relief, she said her body finally started working the way it should once her spine and nervous system were supported. So can you explain how chiropractic care and nervous system health influence digestion?
Yeah, that must sound, if you've not had experience with chiropractic, it must sound like a big divergence, but
yeah. We were so fascinated. We were like,
fascinated,
especially because Steph, you've encountered a lot of like constipation over the years with your IBS, and to know
since I was an infant.
And Kaylee talked about going to you and then you being able to get her regular again, which were without Miralax.
Yes.
All right. Tell us more. Tell us
more. Tell us everything. Maybe remarkably, this is one of the happiest and most consistent side effects of our work. People will sometimes come in with their back hurts or their neck hurts or they've got migraines. And then they come in a few visits later and they're like, this is weird, but I'm going to the bathroom regularly.
Surprise.
Like that's not connected, right? And yes, it is. Absolutely it is. Now, we don't treat any diseases, that's not what we do. But when you understand that the nervous system is orchestrating all of these things, if there's imbalance or pressure, interference in the system that orchestrates even your gut motility, of course it could make an impact. And I loved hearing Kaylee's story because it's really not it's not unusual, and it was my story too, my personal story early on. So the reason that digestion is impact, again, is neurological in nature. And one of the shifts the body experiences as a result of an adjustment is a balance in the autonomic nervous system. Now, as teachers, I feel like in childhood development and some of your training, you probably have some awareness of the autonomic nervous system. That's, like the difference between sympathetics is fight or flight, right? Versus the parasympathetics, which is rest and digest. And when your kids are in which side.
Mm-hmm. We sure do.
Sure do, especially 2 days before a holiday.
Yeah, right. So, and you can see it in children too, and perhaps children that have come from households with a lot of stress or trauma or things like that. You can see where they're at in their nervous system, But again, that autonomic nervous system is shifted out of fight or flight and into the parasympathetic side when you get adjusted. It's one of the reasons that things like blood pressure can change or heart rate variability can change after an adjustment. So again, if you're familiar with this part of sort of our wiring, the sympathetic fight or flight system is there to protect you, right? And when you're in that space because you have misalignment or trauma or injury or illness, when you're in the sympathetic side of your nervous system, your brain doesn't prioritize things like digestion or sleep or sex reflexes or healing or procreation because there's danger. And that is biologically appropriate. If there's actually danger, it's like biologically appropriate.
Saber-toothed tiger. I think about back in the day, you're getting chased by a creature, right?
That's right. And you ought to be hyper vigilant when that saber-toothed tiger comes around.
Yes.
You shouldn't be super relaxed, right?
Turns out there's no more saber-toothed tigers, so we got to chill out.
Right. Turns out you just have a deadline.
Right.
So in that space, though, your brain just wants to keep you alive. So what becomes maladaptive, though, is if you're stuck in that space of fight or flight all of the time, your gut motility might be different. Your digestion's going to be downregulated. Sleep, deep rest is hard to get to, and healing becomes quite difficult. So what we notice is that you can't be in a healing state when your brain thinks you're in danger all the time. So you might not be able to move your bowels regularly or sleep very well. And adjustments which restore autonomic balance, they'll also return your body to a sense of safety. And so your physiology can then sort of catalyze a change in many different systems where in a more direct way, the mechanical events of digestion, like the smooth muscle knowing when to relax and contract to move food and waste through your system, that when you're in fight or flight, that's dysfunctional. Often it's in spasm, and it's one of the reasons why people suffer with constipation when they're stressed. So in fight or flight, all the sphincters through the gut react differently and can be in spasm. Or create erratic movements. Have you ever been panicky, right? And there's a different response in your GI tract, right?
I always say right before I fly, I get the nervous energy. I always call it the colonoscopy clean out before I fly. I'm like at school, I'm like, oh God, colonoscopy clean out pre-flight.
Yes, exactly. So what happens when we get adjusted and the brain changes, your autonomic nervous system rebalances, you go more into the parasympathetic side when appropriate, and you're better able to relax and kind of drive all of the smooth muscle throughout your gut. So digestion improves, motility improves, things like that. So it makes a lot of sense. And as kinesiologists, we'll even assess the other parts of digestion mechanically that could impact gut motility and digestion, like breathing. Your diaphragm, timing for your diaphragm actually impacts the mechanics of the stomach as an organ. And then you discuss some of the, your pre-flight responses.
Yeah.
But it reminds me of the two sort of large intestine sphincters that we'll often at least check in on, which is just by palpation in the abdomen, the ileocecal valve and the valve of Houston. They respond very differently to stress and often are in spasm of some kind when patients come in and they're in chronic fight or flight. So, and then outside of the neurology and the mechanics that we'll look at in our office in a holistic way as functional nutritionists, we might discuss what you're eating, how you're handling stress. And sometimes for people, it's, if it's indicated, there might be a supplement of some kind that can help you improve your digestion or heal something internally. And stress, honestly, emotional regulation, nervous system regulation is absolutely part of our prescription, because you can't out supplement or out medicate a nervous system that's stuck in danger mode. So that is generally how chiropractic can impact digestion and elimination.
Yeah. You're speaking my language. I mean, I have gastroparesis, so I have a motility disorder.
Right.
But I also can't sleep without medicine.
Yeah.
Can't go to the bathroom without medicine.
Right.
And the ileocecal valve, it's so interesting you bring that up, because I had a doctor years ago tell me that I needed to find a chiropractor who could focus on that, because they felt strongly that's where my problems were.
Yeah.
And I never pursued it other than having my husband ask his chiropractor at the time. And he was like, I don't even know what you're talking about. But you just said it. And I was like, oh my God, this is my sign that I need to go.
So what kind of a doctor was it that recommended it?
A gastro.
Oh, good. That's amazing. And it's absolutely something we work on and educate our patients around. In fact, once there's a lot of patient education that happens in our office, and ileocecal valve and diaphragm and things like that. They're all even eating a certain way for that. If you have issues with that valve, is very important and can totally transform how it behaves. So I wouldn't say it's common knowledge. and like you said, that not every chiropractor also works on it, but it is something we do as applied kinesiologists.
It's wild.
It's
wild how it's like things always come back. This is not the universe's way of saying you need to go to a chiropractor. I'm not sure what is.
And then part of me wonders too, like, how much is all this affecting I'm going through IVF right now. How much is all of this affecting my fertility? You know what I mean?
Yeah.
And Maggie just had a beautiful baby in her 40s. So it is possible.
It is. Oh my gosh, it's possible. And I think of all the Mennonite patients I have that are definitely in their 40s and having lots of babies. But I'd never be so bold as to say that we can directly change fertility, but it's, for me, it was definitely as part of the way that I was taking care of myself. And I knew my nervous system was absolutely informing everything else in my physiology. So it needed to be part of my plan,
Yeah. I'm like calling tomorrow and making an appointment. So.
Me too. I'm really excited. We should go on the same day.
Chiropractic date.
Yes, we could do lunch after. Okay, so something else that Kaylee mentioned when we interviewed her, she said that you talk about the vagus nerve often, and Steph's ears perked up literally because hers was damaged during surgery. So we'd love to understand this deeper. What role does the vagus nerve play in overall health, and how does chiropractic care support it?
Yeah. Steph, could you remind me where it was injured or in what procedure?
I had something called a niacin fundoplication. So I don't know exactly where. I do know that part of my esophagus was partially paralyzed, and then I got gastroparesis because of it. So
Right. Okay. Yes, now I understand. I want to circle back to that, definitely. And the vagus nerve is definitely a common topic in our office. And it's part of the mechanism for restoring the balance to the autonomic nervous system that I just talked about. Okay, that shift we were talking about, going from fight or flight, the gas pedal, to the brakes and the parasympathetics, from danger to safety. The vagus nerve must be functioning well in order for you to switch from one to the other. It's sort of the nerve of capacity. So your ability to go from I'm in danger, I need to be hypervigilant, to I'm safe, I can relax and heal. The vagus nerve is very much part of that shift. And so we see the vagus nerve function better, be more patent post-adjustment. But that said, when there are patients that have been in, let's say, neurological imbalance and like have been in fight or flight for years and years, or had a lot of trauma or illness, it requires some retraining. We can get you adjusted and change your brain immediately, but there is sort of a time sensitive retraining where we've got to remind the brain that it's safe regularly in order to get even better results. So we will test your vagus nerve function in our office.
Ooh, and you can test it?
Yeah, with some of the muscle testing that we do. It's really interesting. And so we'll find ways that are personalized to you, ways to stimulate the nerve. There are generic ways to stimulate the nerve, but we can often identify that sort of these factions or these functions of the vagus nerve pathway are impaired for you. So this is what you have to do to get it stimulated, or will be most effective. And so part of our prescriptive care is to teach patients how to access their own autonomic nervous system, how to get into your own wiring and use the vagus nerve to return to safety. And so in that safety, that's where the nervous system can heal. That's where it can integrate. And because the vagus nerve is sort of that, I said it's the nerve of capacity, all right? Yes. We talk a lot in our industry, in the wellness industry, about calming down, right? We just need to calm the nervous system. And yeah, it is nice to be calm.
Yeah, it sure is.
However, it's not biologically appropriate to be there all the time. We're not meant to be calm all the time. We're meant to sort of swing and oscillate between this mobilized focus and vigilance, or I'm in danger, and then come back down to being able to rest and do all of the things we can in the other side of the nervous system. That swing is very normal. So exercising, in a sense, the vagus nerve is a way to it's sort of like the gear shift, to get through those. Now, for somebody with vagus nerve injury, we'd have to see what testing would reveal, but we would generally work proximal to the injury, right. Higher up, right? And in the nervous system, like at the brainstem level. So the vagus nerve exits, it comes out of the brainstem, okay, in your upper neck, near C1 and C2, the first two vertebrae in your neck. And then it exits, goes down through the throat, down through the abdomen, and winds its way all over the place. But by working on the upper neck in particular, this is where, for some people, we actually send them for 3D imaging of the neck, so we can see in a 3D CT image where, down to the millimeter, there's pressure on their brainstem and how it might be impacting the vagus nerve. So the brainstem's sort of the fuse box for the whole shebang. Yeah. So that's where your autonomic, some control for your autonomics live, your digestive reflexes, blood pressure, heart rate, breathing, right? So anyways, without exception, patients with chronic illness, digestive issues, anxiety, they have misalignment in that area. I've seen that for the last 13 years. And anybody with those issues, without exception, has a misalignment in their upper neck. So
crazy.
It is sort of wild, right?
Yeah.
So the results are really profound when you break that cycle of neurological disconnection and incoherence. Then we just let the body do its thing. And that's what I don't fix people, but our job is to find and unlock the disconnection so that your brain and your body can do their thing. And so that's how the vagus nerve is sort of involved in what we do.
I really just love this idea of like letting your body do everything naturally and like not relying on 700 pills to get you through a day.
Or another surgery.
Surgery. Yeah.
Yeah. Like
absolutely.
I'm coming up because I have echolalia, a rare swallowing disease, and I'm meeting with my thoracic surgeon on Wednesday to review all of my tests to see what's going on with my motility. And part of me feels like in this moment, no matter how this goes on Wednesday, no matter what she recommends, do I turn within first, right? Do I look and see what I can do, you know, by coming to you guys?
Well, and to be clear, I have no nothing against, you know, modern medicine. Gosh, there's so many. I've used modern medicine in so many ways, and I'm so grateful for the bridge of modern medicine, right? In healing, right? And it's an and, not a but. And what most people are missing in their deepest healing experience is usually just their, you know, being connected to their own personal power. So I think there's so much value in riding out the natural methods as far as you can before utilizing, you know, drastic measures. But for lots of people, it's like you do the best you can with the knowledge you have at the time, right?
Absolutely.
You don't even know this is a possibility, you know. So I think we get what we need at different times in our lives too. But
I totally agree. Absolutely. Like I think I had a Heller myotomy surgery with fundoplication in 2019 for my echolalia, and it gave me my life back. I can swallow, I can eat. It literally gave me my life back. But what I'm finding right now is something has changed, something has shifted. My stretchings, I'll go for balloon dilations, and they're just, even afterwards, something feels off, right? But what is it? Like I've already had the major surgery that you can have for echolalia. And yes, do people sometimes need it redone? Do they need to be stretched in different places? I'm interested to see what my thoracic surgeon says to me this week. But I love the idea of just stepping into my own power of what I can control by realigning within my system, you know, and it almost just it gives me a sense of like peace in a way, right?
Yeah.
Right. That like there is power. It's not like we're totally broken or it's hopeless, right? You're not broken. I'm not broken. Right. Like we can heal, we can realign. And when you know better, you do better, right?
That's right. That's right.
Yes, absolutely.
I feel like I was going to ask you this question, but we kind of just answered it. I mean, your website says your healing potential is already within you. And you kind of really like explained how you help patients reconnect with that truth, especially when they've been living with this chronic pain or chronic illness for so long. You help create that bridge for
like almost like synergy, right?
Yeah.
Like synergetically, right? Working together.
Yes.
It's
connection. It's a lovely idea, isn't it? And it's the truth as I know it anyways. There is a sort of a paradigm shift that happens in patients that come under care in this type of care. And like you said, it's the difference between it's about how you view your body and your ability to heal. You know, chronic illness patients, they often, you know, for lots of reasons, haven't gotten out from under what I would say is a really negative cognition about, you know, that they are broken. You said it yourself. You know, they feel that their bodies failed them in some way and needs to be fixed. Okay. And it's sort of the messaging that they've gotten from other practitioners sometimes. But on day one in our office, you know, after hearing a patient's story and testing them, my message usually is, you're not broken. You might be off balance. You might be a bit disconnected.
Right. Need a little help.
That's right. Or your body might need something it's not getting, but you're fundamentally powerful. By natural law, you're powerful. And so reminding people of their power and the wisdom within their bodies is so much a part of the process. In fact, a huge part of what we do is just to help people connect to what their body is telling them, you know, symptoms and even diseases, you know, they are usually a compensation. And if you can understand what the body's trying to manage, and remove the interference from normal physiology, then the symptom usually disappears. There's no longer a need for the compensation. And that idea helps a patient to have more grace and appreciation for their body. So instead of kind of being fearful or attempting to sort of, it's so enticing to like make it stop, like whatever's coming up for you, just make it go away, right? And I totally get that. We want that to happen for you too. However, in the process, if we could pause and go, well, what is this about? Like lean in instead of go away from it, lean in. What is this about? What is my body trying to tell me? And so then there is this a different relationship to what you're experiencing. And sometimes the prescription is a shift in perspective. So
you're preaching what we
right? Exactly. I know this is totally your bag. This is what you have learned through experience. It's visceral for you, right? You already know this in your bones that what you believe about your ability to heal absolutely impacts your ability to do so. That's even empirically supported, So honestly, it's been one of the greatest honors of my life, really, to help remind people that they are resilient and that they're neuroplastic. And for chronic illness patients, that they can recover from deep deficits if their essential needs are met and if their nervous system is integrating. So, even the patients that have come in and they've gone to all the people, they've done the nutritionist and the acupuncture and the energy work and the holistic MD, and they're still coming to us with and struggling. It's so empowering to them to know, but the one piece you don't have yet is your brain and your body talking to one another and integrating the system that literally controls trillions of cells. Once that's online, it's so powerful. And there's so many things I've seen people recover from when their body has what it needs, when it's online.
100%.
I feel so incredibly inspired right now. It is just, you are an inspiration. Everything you shared today is just a wealth of knowledge for so many of our listeners that many are in a really dark place. And this just gives yet another avenue to go down to help and heal, right? And it feels so good. And I'm literally calling tomorrow.
Me too. You better not call before me.
We're coming in. So if you do live local to the Canandaigua, Rochester area, you have one office, right, in Canandaigua?
We do. We have one office with seven practitioners.
Okay, oh, wow. Great. And what's if we were to call, do you guys usually book out a little bit? Usually what's the availability to get in?
We had been booking out for months at one point, and we realized that our next inspired mission was to bring on doctors, train them in this way, and this really heart-centered, holistic, gentle approach. And so now it's not, it shouldn't be a long wait to get in. You should be able to get in fairly quickly with a doctor who's trained in all of these things that I'm talking about, and would really be honored to walk with you.
Amazing.
We are on the same. We're saying amazing.
I feel like this is almost like a missing piece to the puzzle for us. We've done so much mindset work, energy work, Reiki,
all the stuff you said, acupuncture,
meditation, journal, just so many aspects, and we're healing. And I think both of us are at such great points within our chronic disease journey. We're ready. And I love what you said that, it's coming at us when we need it right now. This is it's fitting into our journey, and to honor that. So,
yeah. And I think that's really wise. And don't let go of any of those other things, those beautiful practices you do. I tend to see that this just helps them all work better.
Yeah, absolutely.
I can't wait, because I can tell you right now, my brain better start talking to the rest of my body, because we got lots to do, and I can't be feeling terrible anymore. No more kidney stones.
Oh, yes. I hope you're feeling better. Yeah.
Yes, I am. Thank you so much. I am feeling past that baby and it's out and I feel so free.
Oh my gosh.
Those things
That's what I've heard.
It's like childbirth all over again.
Gosh.
It really is, except you birth it's not an adorable baby.
There's no oxytocin at the end. Yeah.
No, definitely.
Nope. Nothing but relief and back to work. Well, Maggie, it's been a pleasure to have you on. You are an absolute delight and such a wealth of knowledge, and we appreciate you and your time. And if you live local to us, you must check out the Chosen Spot.
Yes, because we will be.
Yeah. Well, thank you for having me, and thank you for sharing your messages and your wisdom and connecting people to this type of idea that healing is about sort of reclaiming your health, as a return. So thank you for having me.
Yeah, you're welcome. Time to step into our power.
Right.
Cheers to that. Well, have a beautiful rest of your night.
Thank you. You as well.
Again.
Yay. Goodbye.
Bye.
So before we leave you, another quick shout out to our sponsor, Cozy Earth. Treat yourself or someone you love. It is the holidays to the softest, coziest sleep at cozyearth.com with our exclusive code IGG at checkout.
Are you loving the podcast? The best way to show it is by leaving a 5-star rating and a few kind words. It helps us to keep growing and reaching others who need to hear they're not alone.
And be sure to join our email list. The link to sign up is in the show notes or in our bio on any of our social media platforms. Being a part of our email list is the best way to stay up to date on new episodes, special guests, recipes, book recs, and so much more.
You can also connect with us anytime on Instagram, YouTube, TikTok, or Facebook. Just search I've Got Guts Podcast or email us directly at ivegotgutspodcast@gmail.com.
Thank you so much for being here and for being part of this community. We're so grateful for you.
Keep going,
keep growing,
and always remember, you've got guts.